Hello everyone. In this PowerPoint presentation, we will be covering the arm, which is also part of the upper limb. When we refer to upper limb skeleton, we do include the pectoral girdle, which actually means chest or breast, and it will be the one that's located in the chest region. In addition to the pectoral girdle, we have the free upper limb that will be what is hanging on the side of the body. And this is why it is called the appendicular skeleton, because it will represent the appendages of the body. The two distinct regions, which are again the pectoral girdles and the free upper limbs, they will articulate with each other in three main joints, which are the shoulder, the elbow, and the wrist joints. The pectoral girdle, as we know from the previous learning outcome, is formed by the scapula and the clavicle, as seen on this image. And between the shoulder and the elbow joint, we find the humerus. Between the elbow and the wrist, there are two bones, the ulna and the radius. The ulna will be medial and the radius will be lateral. You may refer to all these structures as upper limb. However, you may not refer to all these bones as the arm, because the arm is made up of just the humerus, whereas the forearm is formed by the radius and the ulna. So every time we talk about arm from now on, we're referring just to the humerus. Now here we can see how many of these bones we have. We actually have 32 bones that again is going to be divided into these two distinct regions, which are the pectoral girdle. We have one on each side, one scapula and one clavicle, and then the free upper limb, we're going to have a total of 30 bones. There's going to be one humerus on each side, one ulna, one radius, 8 carpals, which are your wrist bones right over here, 5 metacarpals, which form the palm of your hand, and 14 phalanges, which form your digits. And together they will form 19 bones, for a total, again, of 32 bones. Let's talk about all these bones separately in the next few slides. It is important to understand how the upper limb will articulate with the exoskeleton. And there's really just one bone from the upper limb that will articulate with the exoskeleton. And that will be the clavicle, that will have the sternal end articulating with the manubrium of the sternum. The scapula does not articulate directly with the exoskeleton. There are going to be muscles that will unite the scapula to the exoskeleton. However, the scapula will only articulate with the humerus at the shoulder joint. And notice how the clavicle does not articulate directly with the shoulder, as the acromial end of the clavicle will only articulate with the acromion of the scapula. Since we're covering the arm in this learning outcome, I like this image because it shows how the humerus, which is what forms the arm, will articulate with the glenoid fossa of the scapula, and you can clearly see how the clavicle will only be articulating with the acromion of the scapula as well. Therefore, we can say that the clavicle is not part of the shoulder joint. There are only two bones that form the shoulder joint, which are the humerus and the scapula. On a posterior view here to the left, we can clearly see that as well. The humerus, which more specifically, this part of the humerus is what we call the head, will be articulating with the glenoid fossa of the scapula. This part over here is going to be the acromion of the scapula with the spine, and the clavicle is only articulating with the acromion of the scapula. It will not be part of the shoulder joint. So let's take a look at the bone features that belong to the arm. There are a few that I want to talk about. This image to the right is a good reference because it will tell you where all the bone features are going to be located. But it's a little bit hard for you to see in details where the bone features are. So we're actually going to use the image to the left to talk about most of the bone features. The first thing that I want to talk about is going to be the head, which is this part over here that will articulate, like I said, with the glenoid fossa or glenoid cavity of the scapula. Right after the head, we have what we call the neck, Usually when you have a head, you have a neck. This over here is what we call the anatomical neck. Anatomical neck, more specifically, because there's another neck that's called the surgical neck, which will go around right over here. And the difference between the surgical neck and the anatomical neck is that usually when this bone breaks, it breaks right over here at the surgical neck. So this is why this area over here is called the surgical neck, but this area over here right after the head is called the anatomical neck. Notice how right after the neck, you're going to have these two major bumps. These bumps are what we call a tubercle. A tubercle is something that sticks out. You're going to have anteriorly what we call a lesser tubercle and laterally a greater tubercle. Now, sometimes it's hard, especially on an anterior view, for you to see that the greater tubercle is actually bigger than the lesser tubercle. But that's because when we get to the lateral view, you're going to see that the greater tubercle actually sticks out way more. It's wider than the lesser tubercle. In between the two tubercles, we're going to have this depression over here that's called the intertubercular groove, or it can also be called the sulcus, so intertubercular sulcus. And the reason why it's called an intertubercular groove, it's because it's a groove between two tubercles, so it makes sense. Another name for the intertubercular groove is what we call the bicipital groove or bicipital sulcus, because the tendon of the biceps brachii will actually come right inside of this groove between the two tubercles. So that's why it's called bicipital groove or bicipital sulcus. Right in the middle of the shaft or body of the humerus, we're going to find the deltoid tuberosity. Tuberosity is a rough spot, and the deltoid is a muscle, and it's going to be located laterally because the deltoid muscle is a muscle that comes and will insert in the shaft of the humerus laterally. So that's where we're going to find the deltoid tuberosity. Let's move to the other slide where we can see the bone features that are located distally. Before we move on to the distal end, let's revise some of the bone features that we talked already on the previous slide. Remember that this is a posterior view, this is an anterior view. On an anterior view, we can see the head right over here. Right after the head, we're going to have the anatomical neck. Coming around over here would be the surgical neck. Laterally, we're going to have the greater tubercle, and anteriorly, we have the lesser tubercle. In between the two, we can see the intertubercular groove right over here. Tubercles are going to be important for muscle attachment because they are rough projections. On the other side, on the posterior view, we can see the greater tubercle laterally, and we can see the head as well as the anatomical neck right over here. For you to differentiate lateral from medial, always pay attention to where the head is located. Remember that the head will articulate with the scapula to form the shoulder joint. So it does not make sense that the head is going to be lateral. It needs to be medial facing the body. Therefore, the greater tubercle will be lateral. So if we know that this side is lateral, therefore we're going to look for the deltoid tuberosity on the lateral side, right in the middle of the shaft of the bone. Moving distally, we're going to have on an anterior view, all of this part over here is what we call a condyle. Remember that a condyle is a smooth articulating surface. Remember how the humerus will articulate with two bones that form the forearm. Therefore, the condyle will be divided into two portions. There's the one portion that's going to be located medially, which is the trochlea, and the other portion, which will be located laterally, is the capitulum. And how do I know this is medial? Because of the head of the humerus is always going to be located towards the medial side of the body. So again, the trochlea will articulate with the ulna, and the capitulum will articulate with the radius. Now, because this is a condyle, which is a smooth articulating surface, we have these projections above the condyle that are called an epicondyle. Now, don't let the epicondyle get you confused. It is not a smooth articulating surface. It is just a structure that's above, as epi means above. Remember, we have epidermis, which means above the dermis. Therefore, epicondyle means that it's above the condyle. We're going to have one on the medial side. So this big projection over here is called the medial epicondyle. And on the lateral side, we're going to have the lateral epicondyle. Then we have several fossas in the humerus located distally, and these will articulate with the radius and with the ulna. Anteriorly, we have two. There's going to be one right over here, which is going to be the radial fossa, which, like the name says, will articulate with the radius. And then we have one located medially, which will be the coronoid fossa, which will articulate with the ulna. Posteriorly, we just have one big fossa, which is called the olecranon fossa, which will articulate with the ulna as well. And we will talk more about how this articulation occurs in a few slides coming up. But these are the bone features of the humerus that you need to know. Here we have a close-up of the proximal end, where we will be able to see all these bone features again in more details. And the good thing is that we have a lateral view as well, where we can see how big the greater tubercle is compared to the lesser tubercle. So this would be your greater tubercle located laterally. This is your lesser tubercle located anteriorly. And in between the two, we have the intertubercular groove. On this posterior view, this would be the head that will be located medially and will articulate with the glenoid cavity of the scapula. Right over here would be your anatomical neck, and here would be your surgical neck. On this anterior lateral view, we can definitely see the intertubercular groove right over here. This would be your lesser tubercle, and all of this would be your greater tubercle. And on an anterior view, again, the head, the anatomical neck, the lesser tubercle, and the intertubercular groove. And right over here would be the greater tubercle. On the distal end, this is an anterior view. How do I know that this is the medial side? Because of this big bump over here. So even though I can't see the head of the humerus located medially, I know that this side is medial because of this big bump, and because it's a bump located on top of this smooth articulating surface. This would be your medial epicondyle. On the other side, you're going to have the lateral epicondyle. Because these are epi, then this would be your condyle. You can see how it's divided right over here. This would be the capitulum that will articulate with the radius, and this is the trochlea that will articulate with the ulna. A couple more bone features that we have on the anterior view are these big depressions over here, one on the lateral side, which is called the radial fossa, and one on the medial side, which is called the coronoid fossa. On the posterior view, I can clearly see that this is posterior because of this big depression over here. Notice how this depression is way bigger than these two depressions right over here. And this is called the olecranon fossa. And I know that the big bump over here is going to be medial. So this is your medial epicondyle. And on the lateral side, this would be your lateral epicondyle. So these are the bone features that you need to know for the humerus. As we move along and we talk about the other bones, you're going to see how all these bone features will make sense with regards to their name, as they will articulate with similar structures on other bones. So let's move on to cover the other bones.